today is going to highlight a cornerstone of nursing excellence, and that is structured nursing audits and how they serve as a powerful tool in driving and sustaining improvements in clinical practice. Leading this session is Ms. Josnamol George. She's the Assistant General Manager at KIMS Health. She heads nursing quality, education, infection control, and brings with her a rich portfolio of experience. She's a certified quality manager and a gold medalist in National Infection Control Certification. She also is a recipient of the prestigious Scroll of Honor from the Government of West Bengal. With deep expertise and a passionate commitment to quality, she's here to share practical insights that can transform our audit process. So over to you, Josnamol.
Thank you, Madam. Good afternoon, the esteemed nursing leaders and dear participants. I sincerely thank CAHO, Annie, and INS for giving me the opportunity to be a part of this continuous quality education series. It's truly an honor to contribute to such a meaningful platform dedicated to advancing nursing excellence and patient safety. So now let's move on to my topic. So this is sustaining improvements through structured nursing audits, enhancing the nursing practice and patient outcomes. So the background of the nursing audit, as everyone knows, in 1853 to 1855, the lady with lamp, Florence Nightingale, and her 38 associates applies the strict sanitary protocols documented the outcome on wounded soldiers, morbidity and mortality, then recorded the statistics to the meticulous document. This was actually the background of the nursing audits. So coming to what is nursing audit? So it is basically a way to check how well nurses are following the expected standards in patient care. We look at what is actually being done and compare it to what should be done, and based on the guidelines and protocols. So we are mainly comparing the actual nursing practices with the established standards and protocols. So why nursing audits and measure? It's basically the measure of practices versus the laid down protocols. It ensures the quality of patient care. It supports continuous quality improvement CQE. It identifies the gaps and areas for improvement so that we can identify what exactly we came out from the actual laydown protocol. And it enhances the accountability and professionalism, where who will be the actual accountable authority or stakeholder for doing such things. And we do compliance with the accreditation and legal standards in order to meet the accreditation protocols by the NABH or JCIs, and improve the patient outcomes and basically patient satisfaction. Then why the NABH emphasized the nursing audits as part of PSQ? So it basically monitor the compliance with the nursing documentation and care protocols. And by the lay down protocols, we have to analyze whether the gap in practice and in order to take the corrective actions, and regularly to ensure the sustained improvement, systematic and formal evaluation of nursing care, how the nursing care is being provided to the patient, then the practical compliances with the established standards, and finally measure the safety, quality, and effectiveness of patient care. What are the types of nursing audits? The nursing audits are concurrent nursing audits, retrospective nursing audits, and point prevalence audit. The concurrent nursing audits called the audit conducted while the patient is still in receiving care. Mainly the patient, when the patient after admission, during the patient stay in the hospital, we do audit as concurrent. It's called as concurrent nursing audit. Here we are doing allows the real-time correction and immediate feedback. If, for example, we are doing an audit on pressure injury prevention protocol during the patient stay, so we can understand what are the deviation from the actual lay down protocol and policies. So we can immediately correct it during our audit process. Same like during the medication administration audit also, we can do whether they have followed the correct rights of medication administration, any medication error happened in order to prevent the further error. Then audit on infection control practices, like we do audit on HI, prevention of HI, like hand hygiene audit, biomedical waste segregation compliance audit, isolation audit, kind of audit we do when your patient is in the hospital. Coming to the retrospective nursing audit, we do nursing audit done after the patient has been discharged. So it's basically an evaluation of documentation compliance. So we do audit on some discharged patient files. Mainly we are focusing on the discharged patient files. In case of SSI, we used to do a post-operative care documentation of past 3 months discharged surgical patients. And also we do pressure injury prevention care in bedridden patients of previous 2 months of discharge ICU patients in order to check the prevalence of the incidents in the hospital. The next type of audit is point prevalence audit. So it's a kind of, there is always a confusion what will be a point prevalence audit and a concurrent audit. So let's come to the point prevalence audit. An assessment or review that is conducted at a single point in time to measure specific aspect of patient care, nursing practice, or healthcare outcomes. For example, we are auditing in a particular day in the morning. We are just starting an audit to check whether what is the condition of all the patient admitted as an inpatient. What is the pressure ulcer prevention and management protocol? Whether the entire inpatient the entire inpatients are undergoing the particular audit at a specific time. So what is the difference of concurrent audit and point prevalence audit? Here we are just going a surprise audit on audit where the 100% of the components is being audited. But coming to the concurrent audit, we are checking in both cases, we are doing, the patients will be in the hospital, but only sampling we are doing for different nursing audits. So this is the 3 types of nursing audits. Coming to the structure, process, and outcome. Yes, we do all the quality initiatives and the audits through the important structure, that is structure, process, and outcome. Where the structural components, how it connects, you can easily see. I have given certain examples in the slide, where the structure always components to deliver care. For example, as already Ms. Needu has taken, you have responded well, I have seen. So the nurse-patient ratio, availability of necessary equipment, and the infection control measures can be an example. So how we will do audit? So example, are enough trained nurses available? Whether the PPEs are available? So these kind of questions we can include in the audit parameters, so that we can understand the component of structure already met or not. Coming to the process audits, like SOPs is the standard practice we use to measure, as we consider are able to refer the things. So it includes the medication administration, hand hygiene, pain assessment management. So as per the protocol or policy, whether the nurse is able to follow the same, that is auditing here. For example, in case of medication administration, we can check whether the nurse followed all rights of medication administration. In hand hygiene, whether she follow the 5 moments or steps of hand hygiene. On in the pain assessment and management, we can see whether the pain assessment has been done in every shift, or after any interventions, any reassessment has done or not. Coming to the outcome, we are really checking the results of care, the patient satisfaction score, the pressure ulcer or fall prevention. What is the exact outcome of the task or the interventions we have done in order to improve the patient, high quality patient care? Where we can ask the question like, are the patients satisfied with the nursing care provider, or the what is the fall risk incidence of the last months? All our quality indicators will be coming in the outcome audits. So this is an important aspect of the nursing audits, that is the steps in the structured audit cycle. If we want to measure something, but we have to go to the correct steps of the procedure to do an audit. It's not like that in the morning we are thinking, oh, these things is not happening, and we can go and do just a check and coming back, and somebody is telling this is wrong, going to somewhere else and just doing as per her vision. No. They have to follow the steps. The first step, as you know, is there should be a set standard of practice regarding the particular process which we are going to be audited. Again, we have an audit tool based on the standard of practice we lay down. Coming to based on the audit tool, we have to define the audit plan. Who will be doing, how will be doing, what is the methodology you are checking. So all the audit planning has to be, and how frequently we used to do. That is also important in audit plan. Then we have to do with the audit plan, we have to do a data collection through different methodology. We'll be explaining the coming slides. Then we do gap analysis with the lay down protocol and the actual practice of nursing. We have to compare and do a gap analysis. Then we need to do a develop and implement an action plan. That is very important. After getting the data, this person is wrong, that department is not reaching the expected level. Instead, we have to implement an action plan, how we can actually reduce this gap. Then we have to do a re-audit. Let's see detailing. So all the hospital have a standard operating procedure. So I have taken nursing handover through ISBAR. I have taken an example to make you understand a little easier. So the nursing handover, there should be a lay down policy and protocol regarding the nursing handover. There is a 5 pages or 4 pages of SOP we have. Even though we have identified the focus area where I'm going to audit. So important thing, who is responsible for giving a nursing handover, when I have to give a nursing handover, to whom I have to give, and where I have to give a nursing handover, either in the nursing station, in the patient bedside. That should be clearly mentioned in the policy. And what all safety checks I have to do during my nursing handover, that is also very important. Then, and what all things you have to check during the nursing handover, that also the focused area shall be included in the standard operating procedure. So I have just taken a very few points to show you. The next step is audit tool, making an audit tool. So this is an example of audit tool which we have created here. So the audit tool, always keep in mind that that should be according to the standard of our policy. So the audit tool should not be in y-axis and it should not be in the x-axis. So the protocol, the standard operating practice which we are lay down in our policy has to be, the audit tool should be going the same page. So in the prior areas, nowadays we used to do through Google Forms. Before, there are some hospitals still doing in pen and paper. So we always, as the digitalization is compared to the previous eras, is it's updated. So we are always encouraging or enhancing to take out some Google Forms so that it will reduce the time consumption to doing an audit, analyzing an audit. So here I'm just showing a Google form where we have laid down some parameters on the audit tool. It should be clear to the auditor and it should be aligned with the protocol and policy of the same. Coming to the define the action plan. So we have to give a clear-cut idea on the audit plan, how we will do an audit. So this is some audit criteria where we used to do in nursing, where the initial nursing assessment documented within 30 minutes of admission. We have to give a benchmark. So we have to have a standard benchmark and give that benchmark should be clearly mentioned in our SOP, and that audit criteria has to be have an aim to achieve this goal. And the frequency, how we are going to do, daily, monthly, so otherwise once in 2 months. So we have to lay down the frequency, and the audit method also have to plan how we will do. What is the evidence you will show?
Doctor, can I just interrupt you for a moment? Some of them are saying they can't see the slides.
Okay.
Can you just
Sure, ma'am. Sure.
it? Yeah. Yeah, you can continue. Sorry.
Okay. Okay, ma'am. So the audit plan should include the audit criteria with the standard benchmark, the frequency of doing it, and what will be the evidence or the tool which you are looking for to give the accurate documentation for the same. This is very important in audit plan. We should have a trained and objective auditors. So train means we need to give a proper training to the auditors which we are selecting as an auditors. by explaining them what you're going to audit, how frequently, what is the benchmark, and what evidence you will look while you're doing audit. And there should be objective auditors. That is very important. There should be neutrality, avoid favoritism and bias. That is very important. So this is a reason why we are giving a cross audit to the auditors, where the auditor is not checking their own practice and they're going to X or Y department. So this is very important, that they should score the criteria uniformly across the cases. So sometimes what is happening, if there is no audit tool, somebody is going, I will do audit in my own way, and the other one is going their own way. So with the audit sheet, we have to send them and have to instruct them, you should give a constructive evidence-based feedback. So the standardized audit tool will help the auditor to give the feedback according to the parameters where the gaps she or he identified. And she can easily, we have to train them how to compare with the protocol with the actual practice, and where was the missed entries or deviation from the actual standards. The data collection methods. Yes, we have to take the data from the patient medical records or EMR, the direct observation, nurse interviews, the patient feedback, and incident reports. The patient medical records EMR contains a time-stamped details records of the nursing documentation. So it includes assessment, nursing intervention, medication administration, care plans, etc. So this helps verify that what was done, why, by whom, essential for tracking compliance and accountability. It's very important if you are collecting the data from the patient medical record. Coming to the nurses interview, yes, we can clarify the gaps in the documentation or practice through these nurse interviews. Sometimes the written record does not tell the full story. So the interview allows the auditor to verify why certain actions was taken or missed. Then coming to the direct observation, it captures the real-time practice, not just documentation, or you can directly see what the nurse are actually doing, not just what they have written in the records. And also it helps identify the gaps between the document's care and actual practice. Coming to the patient feedback, it measures the patient satisfaction and it reveals how the patient perceives nursing care, the responsiveness, the communication, the pain management, and the emotional support as well. So the patients may point out the issues not even visible in the documentation. So like they can say the delay in response, poor explanation, or discomfort during the care. Additionally, the positive feedback even can confirm the effective practices, reinforcing the behaviors and system. Then incident reports, as Needu said, it's a very vital, incident reports always play a vital role in nursing quality. So it helps a pinpoint of frequent or reoccurring of issues in nursing practices. It offers insight to the systemic failure, for example, in staffing or in workflow or communication, that contribute the adverse events. So the data from the incident reports guide the development of targeted interventions. It reveals whether the nurses are following established safety protocols and where the gaps is actually evident. Then coming to the representation of audit data. So here we can, after the audit, yes, we have created a standard, created the audit tool. We have trained the auditors. They went and collected the data. So after the data collection, if it is in the Google form, we can easily convert into the Excel. You can use the Microsoft Excel for the data entry and tabulation and auto calculation. We can use bar line or graphs, pie charts, dashboards, or Pareto chart or heat maps. So here, I guess most of us are aware about the Microsoft Excel bar line and pie chart and dashboards, where we are real-time display. In this area, these indicators are highlighted so that this can be give a real-time display to the leaders. Same like Pareto chart is a vital few problems is identified from the entire bucket. Then heat maps is also, we can highlight these areas or units are the focused high risk areas where we need to be more looking to that. Then after that, we need to analyze the gap of nursing. For here, I have taken the nursing handover compliance. So in the first, here you can see this is the audit they have done. The nursing auditors has done. So we can even take out the data, which area, how the complaints for each parameters we can take out from the Google Sheet. So here I have shown the overall compliance of the data. So monthly, then departmental compliance, because this is the area I have given so that we can take out the entire department, how different department, how many how complaints are there. Then out of that, we can see 38% over here, 69. So like that, we can see that we can even highlight the high priority areas with the audits they have done, so that we can focus on those areas in order to give more action plans over there. Even the parameter wise also we can analyze this, as the parameter is itself is having a no compliance, non-compliance. So here the parameter wise analysis also we can show. Then after analyzing that, we identified these are the parameter is having this much percentage. These are the main parameter contributing to our non-compliance, or these are the areas contributing to this non-compliance. We can identify those and can do an action plan. That action plan should not be a one-man army driven program. The auditor has to sit with the entire the nurse leader of the particular area, can involve the nurse educator if the parameter is showing there is an awareness, there is a problem in the staff awareness. So it should be a teamwork. We need to do an action plan. For example, in this audit, we identified that these are the audit findings for which each parameter, what action we have to take. So I'm not reading entire thing because of the time. So I'm just showing you, you can see, and we need to give who will be responsible for what. So if there is no responsible person, it will stop in the action plan itself. And we have to give the audit check also. After this action plan, we will be checking when. So what you need to check on that also we have to explain in the action plan. Then after the action plan, we have to do an action-oriented feedback mechanism. Why the feedback mechanism is important? Sometimes as a bedside nurse or a in charge, or an auditor also think that we have done such a lot, or somebody is coming and doing audit, going and doing all these action plans, but there is no report whether we improved or not, or we are still in the same page, or we reduce. If you're not giving an action oriented feedback to the custodian, then they will think that why this auditor just for namesake only. So we have to know that to whom I have to give the feedback. So the nurse auditor will be giving the auditor to the nurse manager or the registered nurses working in the floor. Then how? It can be unit-based meeting, can be a circular, can be a presentation. So the content should have the identified gaps of the particular department. What was the non-compliances, the unit-specific observation, then how the nursing handover should be and should not be also. And we have to give a timeline for the action, and when will be the re-audit is happening should be explained to them. We have to give a timeline to them, and the responsibility has to be assigned to the nurse manager and nurse educator as the gap identified that there is a training issue as well. Then the re-audit. Then the re-audit is also important to compare how the baseline data was, then after the action taken, how they, what is the status of them. We are comparing the result with the baseline audit in re-audit. So we can use bar graphs or pie charts to visualize the improvement, identify the areas of continued non-compliances for further actions. Even though we have done we have executed our plan A, it's not works. After re-audit, we identified that we can apply our plan B. So very important to re-audit how our audit action plan was effective, in order to check that we need re-audits. So this is the re-audit data I'm just showing you in the nursing handover. So the pre-data was like this. After taking the action, implemented our action plan, the post data comes like this. So sometimes it can go down, maybe in the same way. So we have to change our action plan according to the result we are getting. Then we can compare the high priority areas. So this was the blue was indicating that before the action plan, those area was like this. After the action plan, department specific, we are able to achieve this many improvement in their data. Then we can even compare the morning, evening, and night shift as well, because in the audit tool itself is there handover timing, morning, evening, night. If so, we can see that the morning and evening shift handover is very good in compare with the evening shift is giving handover to night shift where our leaders are not present. So we can even do a little more dig into the data to show the audits as well. Then we can even compare the parameters wise comparison we have done before the action plan we have implemented, even after that. Then we can understand that in the initial stage, one parameter was very low. After our action plan, it increased. Sometimes the unexpected parameter go down as well. Then we can again do the action plan according to our audit result. Then what can be audited? So these are the few examples which I have given that what we can audit. So only very few in the nursing documentation, there are number of nursing documentations. So just given as per the NQIs laid down in nursing excellence or NABS, nursing initial assessment, nursing care plan. Coming to the patient safety and risk management, we can check the fall risk they have assessments are done properly, or pressure injury prevention protocols they have taken. The hand hygiene or PPE use is there or not. In medication management, we can check whether the nurses follow the rights of medication, the drug allergies mentioned properly or not, how was the high alert medication handling. Communication, again, shift handover. Infection prevention, we can check whether the care bundles were properly documented or done. Isolation protocol, proper biomedical waste management. Timeline, we can mainly focus on the call bell response time. The most of the patients are complaining about the same. So we can check an audit on that. We can here we can use all the data. We can interview the nurse, we can interview the patient, we can check the patient records, the incident form, everything, all the audit collection, data collection methods we can use. And the outcome indicators always, yes, we do monthly. So we can have some we can audit the outcome indicators of patient fall, medication error, patient satisfaction, feedback, like that. Then the last slide, the digital tools and dashboard in nursing audit. So nowadays, other than the pen and paper, we can use our digital tools and dashboard for nursing audits. So the electronic audit checklist, it's a standard audit process. Every auditor uses the same digital platform. So we can ensure the consistent data collection across the shift and even in the unit and in the auditors. It reduces the subjectivity and variability seen in the paper-based audits. So it improves, actually why we are using electronic audit checklist, because it improves efficiency and accuracy. So with a drop down or checkbox or auto fill and a mandatory fields, the electronic checklist reduces the human errors and ensure no key items is missed. Then integrated with EMR or EHR, it pulls actually real clinical data automatically. Nursing audit can extract relevant informations like vitals, medication administration, care plans, documentation directly from the EMR. So it reduces manual data entry, saves time, and ensure the audit reflect actual or real-time clinical actions. So in TrackCare or the Yashasi, the software we are using, we can easily download the audits. For example, time of emergency. So it in TrackCare or Yashasi itself, there is an audit report at the end of the month. You can easily download it. Same like initial assessment. When the patient came, when the initial assessment the nurse has completed, it's there in the EMR. So we can download the audit report. Then coming to mobile accessibility, yes, of course. The nurse and auditors can perform the audits directly at the bedside using a mobile device. No need any pen and paper, no desktop is needed. And great for concurrent and real-time audits is very important, because she can go with her mobile during the audit. As a live audit, she can assess how a nurse is giving a handover. Then coming to auto-generated report, once an audit is entered digitally, the system automatically compiles into the reports. So it allows the nurses and quality teams to focus on the action rather than the paperwork, basically. Then the real-time dashboard, it actually displays the audit data as it is being collected, like hand hygiene compliance, documentation accuracy, fall prevention, rounds, etc. The nurse manager can instantly see actually which unit are meeting the standards and who needs support. Then automated alerts. Where it's a time for hourly rounding, your IV lines, please check your IV lines to reduce the dependence on memory and manual follow-up actually. Then coming to secure cloud storage, the audit data includes the checklist, scores, documentation images is uploaded and stored in the cloud. It making actually accessibility anytime from anywhere by authorized staff. So this eliminates the basis of paper-based records or local only files. This can ensure the data security as well. So here I'm concluding my topic. So I just want to say that sustaining improvement in nursing care is not about adding more tasks. It's about ensuring the right practices are followed consistently. So structured nursing audit provide a powerful framework to evaluate, reinforce, and standardize are based on evidence-based protocols. So by using this audit, not just a tool to compliance, but as a pathway to learn and growth. So we can build a culture of accountability, safety, and excellence, where quality can become a habit, not an exception. Thank you so much.